This web clip provides an historical overview of research on the medial temporal lobe and on monkey models of human amnesia. The research I'll discuss addresses the neural substrates of visual perception and memory. My name is Elisabeth Murray, and I'm head of the section on the neurobiology of learning and memory, part of the Laboratory of Neuropsychology at the National Institute of Mental Health in Bethesda, Maryland. Our story begins, of course, with patient HM. You've already learned that HM received a resection of the medial temporal lobe in both hemispheres for relief of his epilepsy, which was intractable to other forms of treatment. As a result of his surgery, HM lost the ability to make new memories, at least of the type he could tell anyone about, called declarative memory. Because removal of the medial temporal lobe caused HM's amnesia, studies in monkeys attempted to identify which part or parts of it contributed to memory. Early attempts to replicate HM's amnesia in monkeys, which started in the late 1950s, failed. For example, there were no effects of medial temporal lobe lesions on object discrimination learning, a type of long-term memory, and likewise there were no effects of medial temporal lobe lesions on delay tasks, such as spatial delayed response. Roughly 20 years went by without major advances in developing a monkey model of global anterograde amnesia. Then, in the mid-1970s, two groups of memory researchers, one headed by Mortimer Mishkin at the National Institutes of Health and the other by David Gaffin at Oxford University, made some progress using the delayed nonmatching-to-sample task, called DNMS for short. Although this task had been used for decades, their new versions used unique objects for each trial. As shown in the schematic, each trial consisted of two parts, a sample presentation and a choice test. Monkeys first see a sample object overlying the central well of a 3-well test tray. They can displace the object to obtain a piece of food hidden underneath. A few seconds later, on the choice test, monkeys see the sample plus a novel object, now overlying the lateral wells of the test tray. The monkey's job is to approach the novel object, here the pink cylinder, to earn another food reward. Once the monkeys learned the basic task rule, they were given a performance test intended to tax their memory. I'll describe those results in just a minute. First, here's a photograph of a rhesus monkey performing the task in a traditional manually operated test apparatus. These days, most of our behavioral testing is automated so that monkeys touch two-dimensional images on a color monitor fitted with a touch-sensitive screen. These are the results obtained by Mishkin using the delayed non-matching-to-sample task in monkeys. The curves on the left show the effects of imposition of increasingly longer delays between sample and choice, from 10 seconds to 30, 60, and finally 120 seconds, presented in blocks of trials. The curves on the right show the effects of the list length testing. Again, as shown in the x-axis, monkeys were required to remember lists of 3, 5, or 10 objects. For the list length testing, the monkeys displaced one sample object at a time until the list was done, and then performed a series of choice tests, again, one at a time. Because the list length is confounded with delay, the approximate interval between sample and choice for each item in the list ranged from about 1 minute for each item in the list length 3 condition to about 3 minutes for each item in the list length 10 condition. The y-axis shows percent correct responses, and chance level performance is 50% correct. Importantly, all the monkeys performed well with short delays between sample and choice, here the 10-second delay condition. Because of this, we can be confident that they could perform according to the non-matching rule and could discriminate the objects. Normal monkeys performed well across all the delay conditions and all the conditions of the performance test, maintaining better than 90% correct responses. Monkeys with aspiration lesions of the amygdala or aspiration lesions of the hippocampus alone also performed quite well. Finally, monkeys with combined aspiration lesions of the amygdala and hippocampus, sometimes called A+H lesions, were profoundly impaired, and their scores dropped to near chance levels of performance with delays of 60 seconds or so. Based on these results, Mishkin concluded that combined damage to the amygdala and hippocampus likely was responsible for the global anterograde amnesia seen in patient HM, and the first monkey model of human amnesia was born, the A+H model. The conclusions of Mishkin and of other investigators studying the medial temporal lobe at the time were based on aspiration lesions in monkeys and on clinical reports in human patients. It was therefore possible that the lesions, in addition to affecting the intended or reported structures, also produced unintended damage to fibers of passage. With the advent of magnetic resonance imaging, or MRI, it became possible to make selective lesions of deep brain structures in macaque monkeys. Structural MRI scans provided an atlas of each monkey's brain, which allowed precise localization of specific brain regions. Then, stereotaxic surgical approaches, combined with injection of excitotoxins, could be used to make selective lesions. These lesions avoided disrupting fiber tracts that might be passing near or through the area of the lesion en route to their termination in other regions. The new approaches were used to test the first monkey model of human amnesia. The test of the A+H model revealed two surprising findings. Selective lesions of the amygdala and hippocampus made with the excitotoxin ibotenic acid, shown here in yellow, had no effect on monkeys' performance on the delayed nonmatching-to-sample task. In addition, lesions of the perirhinal cortex and entorhinal cortex, sometimes called rhinal cortex for short, shown here in purple, caused a severe memory impairment. The scores of this group were nearly as poor as those of monkeys with the combined aspiration lesions of the amygdala and hippocampus we saw earlier. These data indicated that, at least within the medial temporal lobe, damage to the rhinal cortex was both necessary and sufficient to produce severe impairments on the delayed nonmatching-to-sample task, and they falsified the A+H model of human amnesia. On this medial view of a macaque brain, I can explain the pattern of results. It appears that, rather than combined damage to the amygdala and hippocampus, it was combined damage to the anterior and posterior portions of the entorhinal and perirhinal cortex, regions underlying the amygdala and hippocampus, that was responsible for the impairment on delayed nonmatching-to-sample. As a result of these findings, proponents of the medial temporal lobe theory of human declarative memory faced a choice. They could abandon the delayed nonmatching-to-sample task as an assay for HM-like amnesia in monkeys, or they could substitute a set of cortical areas for the amygdala. They chose the latter, the 4-area monkey model of human amnesia. In this model, 3 cortical areas, namely the perirhinal cortex, the entorhinal cortex, and the perihippocampal cortex, take the place originally assigned to the amygdala. The 4-area monkey model has also been falsified, although there remains some controversy about some of the results. In 3 tests of stimulus memory, shown in the table, complete lesions of the hippocampus have no effect. One of these tests is the delayed nonmatching-to-sample task discussed earlier. The other 2 are tests of long-term memory. The cross-modal DNMS task examines the ability to associate the tactile and visual qualities of individual objects, and the paired associate task examines the ability to make arbitrary associations between different visual stimuli. And in each case, the rhinal cortex is essential. Still, for reasons surpassing understanding, this remains the prevailing model of human amnesia, the 4-area monkey model of human amnesia. To review, the areas included in the 4-area monkey model of human amnesia are the hippocampus, the entorhinal cortex, the perirhinal cortex, and the perihippocampal cortex. The amygdala also contributes to memory, but is not considered to contribute to declarative memory, and is therefore not included in the model. So what, if anything, is the medial temporal lobe? Is it a functional entity that subserves declarative memory? Our results show that it is not. Instead, the medial temporal lobe is a set of diverse telencephalic structures pushed into proximity during primate brain evolution, an accident of history. Do the members of this set of cortical areas function in memory but not in perception, as sometimes claimed? Again, the answer is no. Each cortical area contributes to perception and memory in its own specialized way. On this final slide, I will elaborate on these 2 points. I don't have time to go into the details, but experiments in my laboratory with Alicia Izquierdo and Mark Baxter showed that the amygdala updates the value of foods associated with objects in accord with current biological states. However, the amygdala is not necessary for either object perception or object memory, per se, and the hippocampus does not contribute to this process. As for the perirhinal cortex, studies carried out with Tim Bussey and Lisa Saksida, now investigators at Cambridge University in the UK, showed that the perirhinal cortex contributes to perception as well as memory. The perirhinal cortex thus performs the same computations in both the delayed nonmatching-to-sample task and in perceptual discrimination tests involving stimuli with a high degree of feature overlap or feature ambiguity. For both perception and memory, the perirhinal cortex represents an object-specific conjunction of features. The hippocampus plays little or no role in this function. So much for what the hippocampus doesn't do, but what does it do? Separate lines of research show that it plays a role in tasks requiring the memory and perception of scenes, and in performing a matching-to-location task in which monkeys navigate through an open field to forage for hidden foods. I don't have much to say about the parahippocampal cortex. What I can say, however, from a historical perspective, is that the prevailing monkey model of human amnesia is due for a complete overhaul. My colleagues and I are working on that.